Go.
Who here has seen the show Botched? If so, then you're aware of some of the complications that can come with cosmetic surgery. In today's society, one's personal image plays a major role in influencing how they view themselves. Many people view cosmetic surgery as an outlet to fix parts of themselves that they don't like. The health risks of cosmetic surgery are high, and people choose to remain ignorant of these risks. There's always the possibility of a poor outcome. Sometimes surgery doesn't meet the expectations you have set in your mind, and this can lead to depression and sometimes suicide. As I mentioned before, the TV show Botched highlights a lot of the negatives involved with cosmetic surgery. For example, the show featured a woman named Tawny Kitaen, who was at the height of her modeling career when she felt her breasts were holding her back. When she went to have a breast procedure done, the doctors took the liberty of choosing the size of her implants. Within 6 months, she was having complications with her implants slipping down to the bottom of her rib cage. Studies over the past 7 years have shown that there's an increased risk in suicide, just slightly over twice of the general population, among women who have had breast augmentation. Yet in the past 20 years, breast augmentation has more than tripled. There's also a possibility of medical complications. Like with any surgery, there's always the possible medical complications, and cosmetic surgery is no different. Some complications include scarring, nerve damage, numbness, infection, hematoma, and sometimes even death. According to the U.S. National Library of Medicine, 15 to 30% of people who undergo a tummy tuck are at the risk of seroma, which causes bodily fluids to pool beneath the skin and swelling, which can cause swelling and pain. Also, 1.1 to 2.5% of people who undergo breast augmentation suffer from infection. While this number may seem small, over 400,000 women undergo breast augmentation surgery every year, and only 25% of that is for medical reasons. This is why it's very important to do your research and understand what are the common risks associated, and to choose a surgeon who you trust with each procedure. There's websites out there. There's a website called abms.org, which is the American Board of Medical Specialties. This lists surgeons' credentials, and you can properly research your surgeon to make sure your surgeon is qualified to do a procedure. Sometimes cosmetic surgery can help alleviate physical pain though. For example, I suffered from chronic sinus infections my whole life. I went to a specialist and found out that I had a deviated septum, and because of that, I was unable to breathe out of one of my nostrils. This caused tons of problems, and I wanted to fix it. After I underwent the surgery, I rarely get sinus infections anymore. I'm happy with the outcome. However, I didn't make this decision without the proper research. I made the decision to undergo the procedure because I researched it. I trusted my surgeon, and I had realistic expectations of the outcome of my procedure. In my case, cosmetic surgery helped with medical discomfort, but more often than not, cosmetic surgery is used to ease personal discomfort, and many times there are risks that are seen and unseen. So there are a lot of risks involved with cosmetic surgery. Some of these risks are clear to see, such as the risk of medical complications, while others are harder to see, such as self-esteem issues. Cosmetic surgery has only become more and more popular, and evidence will show that it will continue to increase. That is why it is important to be educated on all the factors that come into play with cosmetic surgery. Thank you for listening to my speech. I appreciate that.